According to the classification of antidepressant, these are the another types of drugs which used in depression therapy. The selective serotonin reuptake inhibitor. It is a good absorption after oral administered drug. The mechanism of selective serotonin reuptake inhibitor is this drug inhibit the serotonin reuptake into the presynaptic cell, which prompts to increase the level of serotonin reading to greater postsynaptic neuronal activity. They do not have significant effect on norepinephrine and dopamine. They typically take 2 to 12 weeks to produce improvement in mood. The adverse effects are anxiety, insomnia, agitation, sexual dysfunction, weight gain. The therapeutic uses of this selective serotonin reuptake inhibitor is depression obsessive compulsive disorder, panic disorder, generalized anxiety, premenstrual dysphobic disorder, bulimia nervosa. These all are the disease which can be treated with this selective serotonin reuptake inhibitors. Next is atypical antidepressant. They are mixed group of agents that have action at several different sites. The mechanism of action of these categories of drugs is similar to the selective serotonin inhibitors. It inhibits the reuptake of serotonin leading to increased concentration in brain. The adverse effects are anxiety, restlessness, blurred vision, constipation, agitation, dry mouth, and nausea. The therapeutic uses are it can be used frequently in patients with major depression who have inadequate responses or intolerable side effects during first line treatment with selective serotonin reuptake inhibitors. Atypical antidepressants are often first line treatment if the drug has desirable characteristics like sexual side effects and weight gain occur less often with bupropion than selective serotonin reuptake inhibitors. The next topic of this slide is anxiety. Do you know what is anxiety? Anxiety is an emotional state unpleasant in nature associated with uneasiness, means a fear that seems to arise from unknown source, discomfort and concern or fear about some defined or undefined future threat. Some degree of anxiety is a part of normal life. Treatment is needed when it is disproportionate to the situation and excessive. Some psychotics and depressed patients also exhibit pathological anxiety. The physical symptoms of severe anxiety are similar to those of fear, such as tachycardia, sweating, trembling, and palpitation, and it involves sympathetic activation. These are the some physical effects of anxiety disorder. Some patients feel dizziness, decreased sex drive, irritability. Whether others may feel increased muscle tension. In some cases, patients also get sweat and feel chest pain. Other cases or included physical effects are rapid breathing, breathlessness, heart palpitation, increased blood pressure, or sometimes nausea or diarrhea. These are the classes of anti-anxiety drugs. Benzodiazepine. In this group, diazepam, chlordiazepoxide, oxazepam, lorazepam, alprazolam is categorized. Azapirones are the next class of anti-anxiety drugs. Buspirone, gepirone, ispapiron is categorized into this class of anti-anxiety drugs. Some sedatives like hydroxyzine are used as anti-anxiety drugs. Barbiturates like amobarbital, phenobarbital, pentobarbital, thiopental are used. Beta blocker like propranolol used as anti-anxiety drugs.